Hey friends, I am sitting in my hotel room at Cleveland Clinic, and I just wanted to give you guys a little update of everything that's gone on while we were here. Um, we're actually staying an extra night. We're supposed to be driving back today, um, but I will get to that in a minute. So we drove here on Monday, just thinking we were gonna like chill and swim and stuff like that. But we actually haven't gotten in the pool at all, even though we really planned on it. It just hasn't really worked out. But we just kind of hung out and stuff, got all set up, and then Tuesday I had an appointment in the morning with my eye doctor out here. He was able to squeeze me in, which is incredible. Both my eye doctors are basically world renowned and are so wonderful at being able to just squeeze me in whenever I really need it. Hey Sarah. So some of this is stress related, but and I knew that some of my symptoms would get worse with all of the stress that I've been experiencing the past couple months. But this is like kind of insane. So I have been in like a massive Crohn's flare for the past month, and um it's like I don't want to say I'm back to square one because hey Silva, because I know a lot more now and I have coping mechanisms, and I know how to navigate it better, if that makes sense. But it was time to come out and be scoped. So I have a bunch of different doctors out here, but mainly I just do video and phone visits with them, and then we come out in person when I need any type of testing. Hey Amber. So that was the first thing we had on the schedule. It was actually today. They scoped EGD down my esophagus and then into my ostomy, an ileoscope to see like how much inflammation there was and what was going on. And I I knew that it was going to come out like this because I am that person that my symptoms never match my test results, and it's uber frustrating. So sorry, I was going to go in order, but now that I'm talking about this, hey Barbara, I might as well just tell you about the scope. So it was unremarkable. So it's just really frustrating. Hey Virginia. Um, but so they took a bunch of biopsies while they were in there, and even though he didn't expressly see something that he thought he was going to see, we'll wait to get those back and have another medication that we're going to try again. But hey Jess. Um, so I'm kind of at a standstill on that. Um, but back to Tuesday. Sorry, my brain. I'm still technically on anesthesia, but my brain has like been darting all over the place. So just bear with me. So I did see Dr. Trabolsi, my ophthalmologist, yesterday, and my suspicions were correct. My vision's getting worse. Um, and he told us about a study that is happening in Pittsburgh and France. Well, he actually said it really weird. I asked Phil when we got back, where the heck was he talking about? And Phil said that he just said it weird, but that there were multiple ones, like one in Pittsburgh and one in France. I don't know why he said somewhere between Pittsburgh and France. It didn't make any sense. We're like, that's the ocean. But so there is a thing where they are doing gene sequencing, and they're like implanting, I guess, well, it's gene therapy. So they're not replacing the gene that's missing or where there's a flaw, so to speak. But they are using genes to help make people's conditions better. Right now, that study only has like 3 or 4 people in it, and they're required to have a very specific gene that is messed up or missing. So I can't be in that right now, but he thinks that once they progress through this study, that then the idea is if it works on this one thing, then it will work on everything. So they will open up the study and more people will be able, thanks, more people will be able to be in the study and hopefully see results. So he's going to keep an eye on that study and then other ones that are going on and let me know. I am still in the study at Indiana University. But that is a little bit like all my doctors are disagreeing on this. So, this doctor out here and my doctor in Philly consult together, and they both, I thought, had ruled out this Almiron toxicity. It was a drug that I took a long, long time ago, but for years. And there was a class action about it last year. Phil actually found it and said, hey, I know you took this. Is this like they're all experiencing eye symptoms? Like, is this something that could be it? So I read through it, but I just didn't think that it fit me because they all had symptoms while they were taking the drug. And then a lot of them, it resolved when they stopped taking the drug. Some people still had lasting symptoms. So I didn't have any symptoms while I was taking the drug. In fact, it only just started like the last 2 years. Well, I've been off the drug at least 10 years. So I was like, I really don't think this is me. Well, it's something that both doctors were tossing around, a little bit, but I really thought we had ruled it out. But then when my Philly doctor, Dr. Alaman, had, I guess he's friends with the woman or knew of the woman in Indiana, doing the study. So he got me hooked up with that. And as you guys know, we went out there, gosh, it was August or September, I don't remember, for the first time. And I said to her, if you find out that this isn't Almiron toxicity, can I still be in the study? And she laughed. And I just kind of looked at her weird. And I'm like, what's the deal? And she's like, well, I just don't think that's going to happen. Like, you definitely have this. And I'm like, well, that's not what my doctor said, So it's just been kind of a weird thing. And then when I was talking to him about it here, he said, well, it really doesn't look like it to me, but I don't have a lot of experience with that drug. And he had a medical student there and she was looking up the scans for like what it looks like with that thing. And they really didn't think it was that. And I said to them, honestly, like, I think this woman really wants to study me. And the only way she can do that is by saying that I have Almiron toxicity. And they were like, yeah. So, I am always that one person that's going to have like a weird thing or, if something can happen to one person, it's going to be me. So when I was out in Indiana, I said, well, couldn't this be both? Because they definitely know that I have IRD, inherited retinal dystrophy. It's my disease. And she said, well, yes, it's not typical, and so she kind of was saying that she thought taking the drug like triggered the gene to flip on, so to speak. But it's really just kind of up in the air because, everyone I talk to says something different. But it was such a validating appointment. If you've never had something weird medically, then you probably won't get this or why it means so much because, normally if I would tell you some of my symptoms, you'd be like, what the heck? But as I was saying them to the nurse and the doctor, they were like, oh yeah, like we already know, like, oh yeah, that's really a thing. And I know that doesn't sound like a lot, but it really was, it was really important to me that, it's not, I've been the patient where they've said it's all in your head, even though I knew it wasn't. So just having people that understand what's happening is a big deal and who treat you as a valid part of the team. I am at the point where I will leave a practice if they don't do that. I know my body better than you do. So yeah, I have to be a working part of the team for sure. And then I've been wanting to go to a low vision center. Um, and they have a really spectacular one here. It's a nonprofit. It's not part of Cleveland Clinic, but it's right across the street. And so he put the referral in. He told me that he's tried to get people in quickly and has never succeeded. He thought it would take months, that we'd have to come back down. But I talked to them and was able to get an appointment tomorrow morning. So that's why we're adding on the day. And Phil really didn't disagree, but I mean, sorry, he really did disagree about staying, but we're staying. And it's so important to me to go do this evaluation. And then they set me up with, they call it a case manager. So I won't have to keep coming out here. I will go get the evaluation done tomorrow morning. It's like 3 hours more battery of tests. And then I will work with the case manager who will set me up with people and services near me. So that will be amazing. And I have a phone call with her while we're on the way home tomorrow after the testing. And they were able to get everything transferred over from the eye doctors. So this center is like, they talk to you and find out, what you're experiencing, what you want to be able to do, what you need help with doing, but then also teaching you about the technology that's available and the adaptations. And that's where I'm at because there's no surgery, there's no medication for what I have, and it's progressive. So as you guys know, I mean, it's been a heck of a year. Let's just say that. So, for me, even though some of the doctors think I've had it since birth and, our town didn't have the machines to test for it and it was just overlooked, which really pisses me off, but that's another story and we can't do anything about it. So all, like, in the past 2 years, like, all of the symptoms have just been flying and cascading over each other and happening. So it's just been a lot. But it was nice. It was nice to have them say, like, we agree with you. This is happening. These are things that you can be doing. And not be like, oh no, you just thought this was happening, but it's not. You know what I mean? So yeah, and then my other appointment yesterday was rheumatology, and my physical therapist and I think that there's yet another undiagnosed inflammation going on in my system somewhere, and that's why, like, my back and neck have been so bad, and my knees aren't healing properly and that kind of thing. But I did go locally and it was not a good experience at all. So my GI doctor out here referred me out here, and man, was it impressive yesterday. I know I posted that it was impressive, but she is so thorough. And even though she's not quite sure what's going on, I mean, I literally had my whole entire body x-rayed yesterday, and I've been stalking my chart to try to see what the answers are. I know she will call me, but the tech said, oh, as soon as I push the button, she'll have them. But I'm guessing now that they don't actually come into my chart until the radiologist has read them. So that is our first step. And she looked at the test that I've already had done. And then after that, depending on what those say, there will be MRIs. And then after that, depending on those, she may order fluid to be sucked out of my knees so that they can test it and see what it is. So as you can hear, like, this is like, they are checking all the boxes, you know what I mean? And she was just wonderful. And also out here, as far as like the eye tests and stuff, well, the last time I was out here and had the test, I threw up. So I was like, I really didn't want that to happen again. And I mean, the tests aren't easy, but I didn't throw up, so that was a big improvement. And the tech that did it was just so good. I mean, I've had these tests a lot in the past couple years, and she was by far the best. I mean, it was so quick. She held my eye open because if you don't know, you're looking into this like big viewfinder thing where there's like different color circles that you're looking at. And sometimes I see them, sometimes I don't. But then they flash huge strobes at you, white and colors, which sets me right over the edge. But that's so that they can take pictures of the back of your eye. And Phil calls these tests laser tags, so we have a joke about that. Because a lot of them have like these red lasers showing through and like floating across the screen. The one, it's called an OCT, takes pictures like slices of your eye, of your retina, so they can look at it. Now, the technology that they have in Indiana, they only have a couple places in the world, and they developed it, and it's taking little teeny tiny pictures like that on the cellular level. So in that way, I hope I can still do it because it will just give them a lot of information. And I wasn't really expecting to learn stuff about me from the study, but I figured if I could help other people, like that makes me feel better. So that's what those tests were. And, more eye tests and holding stuff in front of you and looking at colors and that kind of thing. They were just lovely though. I mean, even though it's a hard situation, it was, I don't know, it's just, I felt good about having had that appointment. And then certainly rheumatology, but I was poked and prodded and I almost jumped off the table a couple times. And I'm very much grin and bear it kind of girl. And then the x-rays, again, the tech was wonderful, but it was a lot of like twisting my body in ways that it didn't really want to go. So I've been pretty sore, but no big deal. And then today with the scopes, they put that thing in your mouth that's like a circle and you have to bite on it. I have TMJ, so it was hard to even fit that in my mouth. And then they, put the thing down your throat. So my throat's sore and I'm having a lot of drainage and stuff, but piddly in comparison to all the stuff I've been dealing with lately. So I know that will go away. I just keep drinking hot tea and stuff like that. Sorry, this is a very going all over the place video. I'm sorry that it's not a little bit more organized, but so tomorrow, my appointment's at 8:30 and it's, 5-10 minutes away. So we're just gonna pack the car, check out, and they actually have free parking over there. So we're just gonna go from here to there and then leave to come back to Pennsylvania from there. And then that lady will call me, the case manager will call me while we're traveling. So I don't know, I'll keep you posted and let you know. I know there's a lot of comments here and I will go back and answer them. I don't want to I'm going to have to put it up to my face and I don't want to do that on the video. But yeah, that's the extent of our trip. And I did do the video of the lobby for those of you who haven't seen it, but I wanted to do a nice video of our room and I knew I should have done it when the bed was still all nice looking and we didn't have stuff everywhere, but kind of looks like a hurricane has gone through our room tonight, as we're like trying to figure out what we're doing about packing and stuff like that. So my stuff is ready to go, but there's piles of stuff everywhere. So I don't think I'm gonna, pan out for you, but I know I've done a video in here before. It's not the same room, but you can probably find it on my page. The major issue this time was we got into the room and I went into the bathroom and I flicked on the light and the bright white light, all it did was strobe, and I turned it right back off and called the desk and they're like, oh, we'll send maintenance up right away. Well, 3 hours later, I was still waiting for them. And called back and they, the maintenance guy had already gone home, and they had dropped the ball. So they actually moved us next door and the light in the bathroom is hella bright and I have to put my sunglasses on just to go in the bathroom if I turn on that light, but at least it's not flashing. So, props there that they figured that out for us. And a lot of times I just turn the hall light on and go in there and it's fine for me. But like, the one thing, I'll see if I can show you. Hang on. There's a bunch of different lamps in here and they're like different intensities. So we have been putting a low intensity one in the corner. Hey, Michelle, miss you. Because it's not very bright, but it lights the room enough. So hang on, let me see if I can do it. I'm watching Coco. Yeah, so as you can see, that's the light we have on right now. And I guess I can give you like a little view of the room, but don't mind our mess. The bed is so comfortable. And I think, as I explained the other day, the reason that we wound up picking this hotel when we came here is that it's part of Cleveland Clinic, and Cleveland shares, like when we started coming, it was during COVID and I was super anxious about it, but Cleveland comes and not only shares their cleaning methods, but they check the hotels to make sure that everything is clean and safe. And they have a patient rate, and a restaurant right here. So it just works out, you know. Yeah, so with this disease, the sun physically damages my eyes and makes it progress faster. So you will always see me in a big hat and sunglasses, and I have to have brown sunglasses. It's about like the colors of light that it lets in. So I'm not allowed black, gray, blue, or green. So I know brown sunglasses, it doesn't sound like a hard thing, but it's actually really difficult to find the ones that I need. So I went for my pair, and I think I have. Yeah, so a lot of people do have their topper on and they just throw their sunglasses on top. But because then there's a gap down here. So when I'm outside, I do it the other way. So I can still have my design, but I'll put the sunglasses on and then put the color on top. That way it's not like a gap where it's coming in. When it started, I really wanted to get, I call them horse blinders, but the things that block the sun on the side. And it's virtually impossible to find brown ones, but also that will work with the shade of glasses. It just isn't going to happen. So that's what I do. And I know on camera these look gray or black, but it's actually a version of brown. Oh, the other thing I did was get my glasses adjusted because I keep having, I don't know if you can see. Oh, it's not as bad as it was, but the one thing is like cutting into my face and it's so painful. And I had like big dents on the back of my head because every time someone adjusts it, they either try to move this part or they make the arms of the glasses like tighter on my head so that this doesn't slide. Well, it just wasn't working. So he did adjust it. It is sliding a little bit still, but I think I'm going to leave it like this for a little bit, try to get used to it, and see if this doesn't improve. And yes, I've tried the little pads. They don't work. I love the ear hooks because they really do stop it from sliding, but, you know, it is what it is. So yeah, that's the part of my journey that we've had this week, and I will keep you guys updated, but please let me know. Like, I'm an open book. I'm happy to answer questions. Like, this is a rare thing that, you know, you're probably not going to know about it if you don't know somebody with it. And like this doctor that I see out here, I mean, he doesn't even have that many patients that have it, and there's only one doctor like him out here, even though it's a big old place, you know, with lots of campuses. So yeah, but you guys know with my health history, like we've been all over the place for doctors, and we are the most happy and impressed with Cleveland Clinic. We have not seen anyone that, you know, that we were disappointed in or that didn't try their best to help us. And that is not something I can say about other big name places. So, yeah, in that way, it has been really great. It's 5 hours from us, so that's why I try to stack my appointments and get everybody, um, on board for the trip so that we don't have to, keep adding them on. But yeah, so thank you guys for watching, and let me know if you have questions. And thank you for supporting us with Scentsy. It was a really amazing month, and that is thanks to you completely. And I was able to watch our like little preview video for the month to come while I was here, and there is amazingness coming this month. And it's just in time for my birthday. So it's going to be a really jamming month. And let me know if you're looking for anything special, because I know you're all getting Christmas presents and getting all your shopping done, and I'm happy to help any way I can. So thank you guys, and love you, and I will talk to you soon. Bye.